My name is Jaime Midez. I've been a physician in El Paso since 1995. I'm an internal medicine doctor, but in the last 10 years, I've been interested in different specialties. At this time, I'm board certified in regenerative medicine, anti-aging, and I have a fellowship in stem cells. Today, we're going to talk about stem cells, and if anybody is interested in asking questions, I would like to answer them at the end of the presentation. As a way to introduce this, I would like you to imagine certain things that probably you have asked yourself before. Our body is a conglomerate of cells that is organized in tissues, and those tissues form systems: circulatory system, pulmonary system, nervous system. It is considered that we have between 10 and 13 trillion cells in our body, all of which will become specialized in due time and will accompany us until we die. That is the general concept. However, the cells, according to numerous research, have demonstrated to go into an aging process. It is of popular belief, for instance, that the red blood cells may live an average of 120 days. And the same thing happens with the rest of the cells in our body, including the brain. So the idea is that in our body we are constantly replacing cells. This is a process that needs a huge amount of energy, and in this part is where the stem cells play a very significant role. We are replacing approximately 1.2 billion cells every day. This incredible amount of cells are part of our daily living process and is totally silent, and in reality it is when you first read upon this, it sounds like incredible. But if you think that you're growing hair, for instance, that you have a skin that you think that you have been living with you since you were a child, in reality, we're changing those cells every day. We change the outer layer of our skin every 3 weeks. In reality, the skin you have now is not the one you had 3 weeks ago, and we replace in the form of desquamation. In the base, at the bottom of every single tissue in our anatomy, there is something that is called basal membrane. In that basal membrane is where the stem cells start their transformation into the tissue that is necessary. In the same way as in the example of the skin, in the basal membrane of the epidermis is where there is a concentration of the stem cells that finally will end up in about 20 different layers that constitute the epidermis. The epidermis then that you are seeing is the most superficial stratus, is the stratus corneus. So the same way we exchange the skin every 3 weeks, we exchange the inner lining of our small intestine every 3 to 6 days. Or we change the muscles every 2 months. It's not that we change the entire biceps, let's say. We replace cells that have been damaged and needs to be exchanged. So, as you can see, our body is in constant exchange. And for that, we need the stem cells. And obviously, as I said, with 1.2 billion cells, you need an exuberant amount of stem cells to replace. That amount of cells is present when we're children. As a child, we are not only replacing cells, but are in plain development and growth. And so the children have an excessive amount of stem cells. As the time goes by, the human being gets a slower repair. Even though the needs for repair is the same, our stem cells production decreases. Around 38, 40 years old, a person is producing approximately 60% of the stem cells that they used to produce. In at 60 years old, we're in the 30 to 40%. So if you think that the needs for replacement and repair remain the same along our life, then we're in a constant deficits after 20 years old. That involves an aging process in the tissues, and that's the reason we age in general. The stem cells then play a vital role since our very beginning, and we can say that we are the product of a stem cell, because the very first stem cell produced was the fusion between the sperm and the oocyte, and then that formed one cell that finally will derive into the embryo and will be able to form all sort of tissues in all our body in general. So that way you have the embryo and all the cells that are formed during the pregnancy, especially in the first 3 months, are embryonic stem cells. Once the human being is born, then you have adult stem cells, and those are the ones that will replace your tissues for the rest of your life. The stem cells initially are produced in the bone marrow, in the bones. The bone marrow has all the cells that will create constantly the hematologic components, that mean the blood, red blood cells, white blood cells, etc. But also contains certain cells that are called progenitor cells, which will be the origin of different tissues. So the stem cells replace and repair tissue constantly. And when we are in deficit of this repair is when diseases start. For instance, if we talk about osteoarthritis and degeneration of the cartilages, is because for certain time we haven't been able to replace and repair the cartilage and the tissues in an adequate way. So the stem cells in that case will go there to the area and will be able to transform into cartilage and will fix the problem in a form initially of a patching, and then in the transformation toward the specific tissue. So the stem cells have been studied for more than 60 years so far. In general, the very first therapeutic reaction was with the treatment of some leukemias, where through chemotherapy they were able to destroy the cells of the patient, and the stem cells that had been previously rescued from that patient were inoculated, and those stem cells then will reproduce the tissue we call blood. So in modern days, the therapy with stem cells have become very important. In reality, it's one of the most important therapies that could be considered before surgery. Stem cells, and especially the adult stem cells, are cells that can be transformed or can transform themselves, let's say, into cartilage, into muscle, tendons, bone, and nerve cells, and even blood vessels. So we have one major source of stem cells, which is the bone marrow. But along the years, the excess of stem cells have been deposited in the adipose tissue, in the fat of our body. So in general, in our fat, we have more stem cells than in the bone marrow in terms of volume. So the clinics that are doing these procedures, the therapies, are utilizing basically fat or bone marrow. But there is another form of adult stem cells that can be used, and they are the umbilical cord cells. Nowadays, the FDA has approved certain products that are coming from the external lining of the umbilical cord, called Wharton's jelly, which is full of adult stem cells. So you think you can obtain stem cells from the bone marrow, or stem cells from the fat, or bring a product that is coming from an umbilical cord. The concentration of the stem cells in a particular tissue will improve significantly the healing of that tissue. So in that regard, we have been very successful in treatment of musculoskeletal issues like rotator cuff syndromes, torn tendons and ligaments, and especially in osteoarthritis that have affected the knees, ankles, shoulders, elbows. In my clinic, we use the fat from the same person to obtain the stem cells, and those cells are inoculated in the area of concern. That could be a knee, could be a shoulder, etc. We use that specifically in people that is younger than 50 years old. And the reason is this: your stem cells, whatever your age is, has your own age. So even though they have the potentiality to transform into cartilage, muscle, tendons, etc., they do not have, when you are older than 50, the vitality to work appropriately. However, every person's condition changes, and that needs to be determined according to the person in particular. In autoimmune diseases, the therapy with stem cells have demonstrated to be very efficacious for several reasons. Number one, the stem cells produce anti-inflammatory conditions. Number two, the stem cells produce some growth factors that are very important to us. Number three, the stem cells produce something that is called exosomes. All these products, plus the potential to be transformed in that particular tissue, give the stem cells a tremendous potential for healing certain tissues and diseases. And the same happens with the autoimmune diseases, which are diseases that the body is attacking itself. Rheumatoid arthritis, lupus, ankylosing spondylitis, multiple sclerosis, even Alzheimer's have a significant component of autoimmunity. And the therapy with stem cells have been successful because you put the cells intravenously, for instance, and the stem cells have an immunomodulatory effect in such a way that will decrease all the inflammatory conditions that are producing pain and discomfort in the patient. And at the same time, the cells are able to be attracted to the areas of inflammation. So even in diseases like Crohn's disease, ulcerative colitis, you can put the stem cells intravenously and they will be attracted toward the areas of inflammation, which is the colon in this case. And there is approximately 60% to 70% success in the treatments. Maybe not curing completely, but decreasing symptoms and decreasing all the pain and discomfort. So at this moment, I hope that this information has been adequate to you, and I'm open to any questions that you would like to ask.